all. This is Dr. Mobeen Syed from Drbeen.com. Welcome to one more show. So, today with me to talk about Alzheimer's and especially the connection of Alzheimer's with um sleep is Dr. Josh Helman once again. Dr. Helman, welcome.
Thank you so much. It's a pleasure to be here.
Excellent. Thank you very much for appearing again. Your talk last week was very well received, and I'm sure that people are taking advantage of it. So let's start with this discussion of what is Alzheimer's and then what is the link with the sleep.
Certainly. So Alzheimer's is one form of dementia in meaning the brain is not working properly in terms of memory and processing information and then dealing with emotions. So so it turns out that Alzheimer's is the most common cause of dementia in adults. In the United States, it's about 70% of the cases of dementia turn out to be Alzheimer's. So they're not the same thing, although if I'm talking to a general audience, sometimes I'll use them interchangeably. There are other types of dementia besides Alzheimer's. For example, if you have a brain tumor or a bleed in the brain, those can also cause problems with dementia, problems with the brain. And those are, you treat those often differently. But the connection between Alzheimer's and sleep is when you analyze Alzheimer's. When you look at the root causes, it turns out that there are between 30 and 200 root causes of Alzheimer's. And those causes are different. But when you actually analyze all those different causes, the one that pops out as number one turns out to be poor sleep. And when I say poor sleep, what I mean and what the studies are showing is it's poor N3 deep sleep. So, for example, you could have a normal, you could have 8 hours, a good amount of sleep, but if you're never getting below light sleep, you're not getting to the important deep N3 sleep, during which time the brain is able to clear out the amyloid plaque and consolidate the memories. So again, if you're not getting enough of that N3 deep sleep, you're at, that's the number one risk factor for developing Alzheimer's. And I will say that in many of these cases, it can take 30 years to develop Alzheimer's. It doesn't normally happen overnight. It could take 30 years. And the first 20 years, you may have no symptoms because the brain has an amazing design with backup systems in place.
Understood. Thank you very much. Okay, so I think there is an echo from your side as well.
Mm.
Uh, do you have headphones?
Let me see if I can grab. Let me think of how it works on this
Le-
system.
Let
Um,
me actually ask you the next question and then I'll mute myself.
okay.
So, when you say N3 sleep, is that the theta wave that becomes lesser and lesser as we age further? And if that is the case, what do we do about it?
Right. So it turns out that the N3 is is actually more. It's the delta wave, not the theta. The theta you normally see in stage one and stage N1 and N2. I'm talking about even deeper, where you actually start seeing the delta waves on the EEG.
Excellent. So, does this sleep also, this type of sleep also reduces as we age, or it stays the same percentage as before?
Yeah, so unfortunately, as we get older, the amount of N3 sleep goes down dramatically. Let me give you some examples. So when you're 18 years old, you normally get 2 whole hours of this N3 sleep. But as we get older, by the age of 65, we're down to only 30 minutes of N3 sleep every night. And then even older at age 80, we're down to, um, let me check my numbers here. we're actually down to 15 minutes. So it goes from 2 hours to 30 minutes to 15 minutes. And, so I would love, and I think we all would love, unless we're young, we would love the 2 hours of N3 sleep. But what's exciting is that if you can improve the percent of N3 sleep, you can decrease your risk of dementia. Specifically, for every 1% decrease of your N3 sleep, there's a 22% increased risk of the Alzheimer's developing.
So that is actually scary, because as we are saying that the sleep type would continue to reduce. So does that
Correct.
mean that naturally our risk for dementia would continue to increase?
I think it does, but let's just take a step back. And what we're talking about, the the data we're looking at, is in Western American societies where our lifestyle is not ideal. Specifically, the average person is not eating a diet high in plants. Normally it's high in processed foods, which have added salt, oil, and sugar, which contribute to destruction of blood vessels, which end up impacting our sleep. Most people are overweight or obese, and if you have extra fat in your neck, in your belly, unfortunately, you're also at higher risk of not getting to good sleep.
Understood.
So often a lot of these things we attribute. Oh, don't worry, it's a normal part of aging. No, it's a normal part of aging if your habits are not good habits, if you're not getting the adequate sleep, if you're at high stress, if you know things like that.
I can understand. So tell me this. Bob said this question, and I was thinking about it as well. Is there a contribution in this modern society when we are taking a bunch of food that may not be as healthy, the medicines that we start after 50 and then continue on them, and similarly other habits, pollutions, and environment being difficult, and the stresses of the life? The question is, are these all contributing towards sleep, especially N3 sleep disturbance?
Yes, I believe they all work together to promote that. And in terms of Bob's question, many common drugs unfortunately take away the N3 deep sleep. Let me give you a common example that actually went viral on TikTok when I was talking about it. We over 2 million views when I was being interviewed by Robert Love. Specifically, medications like Benadryl. Sometimes people will take something called, say, Tylenol PM that has Benadryl in it, and Benadryl will promote sleep, but unfortunately, it doesn't promote deep N3 sleep. And Benadryl has been linked chronic use. I'm not talking about one time to get to sleep once or to deal. Benadryl is an allergy medication. So hear me out. I'm not saying one dose of Benadryl and your life is over. No, but I'm saying people who chronically take Benadryl or antihistamines or anticholinergics, if they're taking it chronically, the risk of developing Alzheimer's goes up tremendously because the anticholinergics like Benadryl decrease the amount of acetylcholine in the brain, and acetylcholine is one of the major neurotransmitters in the brain. So if you're taking away basically a big chunk of your brain activity, it makes sense that over long-term chronic exposure that you could develop dementia from that.
Understood. And I know that you mentioned it before, the effect on the brain tissue, and I was trying to find my headphones. The Is N3 more important for brain health compared to the other types of waves?
Yeah, so from the studies, I've seen that the biggest of all the different types, it's the N3 deep sleep. Now, I think it's also going to be REM sleep, but if I had to pick one type of sleep to focus on, I would do the N3 deep sleep. And let me just be clear. It turns out that our sleep systems are not they're a little bit jumbled. For example, you dream not just with N3 deep sleep, but you also have dreams using the in REM sleep. It's just the electrical activity is very different with those two different types of sleep.
Understood. Thank you very much. There is a very interesting question as well from here. Uh, Amanda's Secret Garden. I wonder if high stress can make it lessen at a younger age.
Yeah, so I think that's true. That if you're under high stress, what happens is that your catecholamine level will increase. Here's another example of high stress to the body. Let's say you have sleep apnea, obstructive sleep apnea. Let's say you're young, but unfortunately you are overweight or obese, or for whatever reason you have obstruction when you sleep, meaning you can't get enough oxygen to your brain. That one of the things that happens, because it is a very stressful event to the body, is you'll have increased amounts of epinephrine, norepinephrine. The stress neurotransmitters will go up tremendously, and I think that can definitely be related.
Understood. Thank you very much. So we established that sleep is important and three type sleep is important. And as we are aging through the in this environment, we kind of accelerate our sleep phases to reduce as well, and so that then impacts our brain, and we can have dementias and cognitive declines and Alzheimer's. My next question is, if this happens, number one, how do people figure it out that this is happening? And the second question will be, then what do we do to start fixing it?
Right. So often the way people will notice, or the people around them will notice. Are you asking about Alzheimer's, or are you talking about not enough of the deep N3 sleep?
So if they do not have, so how do, imagine if I'm not sleeping well,
Okay.
what signs and symptoms should I be looking out for that may indicate that my brain health is affected?
Right. So what I would look for is you wake up in the morning and you don't feel real rested. That's number one. Or you realize that you can't even get to sleep, and you're only sleeping for a few hours. And what's fascinating is there turns out to be a sex difference. Men are more likely to have obstructive sleep apnea when their oxygen levels go low, whereas in women, instead of the oxygen going low, more commonly they'll wake up in the middle of the night. Um, so, but but to answer your question, how do people? If you really want to know, you would do a formal sleep study where you're well. There are a couple ways to do it. Uh, they can either do an EEG, so actually measure your brain activity through the whole sleep process. Now there are some newer at home type programs where they'll measure your oxygen level and your heart rate, and those can be helpful. But the gold standard right now is to go to a formal sleep lab and actually measure your brain waves as you sleep.
Understood. Thank you so much. So now the next question is, and by the way, the echo has gone away. Your audio has become a little higher as well. So thank you very much. Uh,
Awesome. I clicked on the right button. So
okay, perfect. So the next question that I have is, if this is happening, do people then take sleep medicines to improve their sleep, or are there other ways to handle this?
So what I would say is yes, there are definitely some medications or supplements that can help with sleep, and we'll talk about that. But there are other things besides supplements or medications that I would actually try first. And the one that comes to mind readily is exercise, because often if you're exercising, your body, exercise is a great thing for your body, but it is it normally it's a stress reliever. And often I find if people start exercising or get more exercise, often their body cooperates and gets more sleep. That's number one. Number two, another good tip to get to sleep is using heat, because when I say heat, I mean hot bath, hot shower, or a sauna right before you go to sleep, because it turns out that the trigger to get to sleep is when your core body temperature goes down. And you may see, like, Dr. Josh, what are you talking about? If you want your core temperature to go down, why would you get in a hot sauna? Well, hear me out. It sounds weird, but when you get into a hot sauna, your core body temperature, your body will intentionally try to cool your core temperature because it says, hey, it's too hot. Now, the trick is you get out of the sauna, but for the next 20 minutes or 30 minutes, your body is still trying to lower your core temperature. So 20 or 30 minutes later, you get out of the sauna, then your temperature is going down, and it's a trigger. It's kind of a hack to basically to get to sleep. But
That
I feel like I owe you some medications and supplements too to answer your question.
absolutely. I want to actually add one more comment here to the sauna. So, one benefit of sauna, and again, you are very much involved with the brain health, so you know this, but for the audience, one benefit of the sauna is that the heat shock proteins are activated. Heat shock proteins function is to start cleaning out our cells and kind of remove all of that. They do not know that there is actually external heat that is causing the crisis or the emergency in the cell for temperature. So they say, all right, we are going to start cleaning up the cell, maybe something wrong in the cell. And in that process, the cells start cleaning up, the lymphatic flow starts happening, and you actually, the whole body, the muscles would feel better, the brain would feel better, and so on. So now I'm going to go to the next part, as you just alluded to. Are there
Sure.
any, sorry,
No, go ahead.
are there any other things other than exercise and sauna? Any supplements? Is melatonin? There's a question here
Sure.
that, for example, from Karen, does melatonin have an effect, positive or negative, on deep and three sleep? So, what supplements and other habits?
Yeah, so I'm definitely a fan of melatonin, and melatonin can promote deep N3 sleep. And there are different places to get melatonin. You can take a melatonin supplement. And I've got to say, they're a lot better now. It used to be 5 or 10 years ago, you had no idea of, it might say one thing on the bottle and it could have 100 times more than that or 100 times less than that. So I'd say that the melatonin industry has gotten a lot better. So taking melatonin as a supplement is fine. My favorite way of taking melatonin is actually pistachio nuts. Pistachio nuts have high amounts of melatonin. So if you eat 3 pistachio nuts, you're going to get the melatonin. And yeah, so I'm a fan of melatonin. Other things that I like to get to sleep are essential oils, specifically things like lavender or lang lang, are two that I'll just I'll either rub it on my skin with a carrier oil or on my feet, or with a company I trust like doTERRA, I'll actually put a couple drops under my tongue. I think the flavor is okay. There's some people like, ooh, I hate, if you don't like the taste of it, don't take it that way. But or you can always inhale it to diffuse it.
Understood. Thank you. And when you brought this company up, I wanted to show the audience. So first of all, the disclaimer to audience that I have no strings attached with Dr. Helman and his business, his practice. So if you contact him, there is no commission. If you go to his site or buy anything, there is nothing I get. My benefit always has been with my guests, that there is some benefit that can come to you. So I'm going to quickly, Dr. Josh, before we continue, I want to quickly share your site.
Sure.
So this is drjosh.com. And here is the site Green Brains MD. And if actually you go to YouTube, this is Dr. Josh's channel as well, Green Brains MD. So here I was actually looking at your page before, and I saw there were some supplements here. So there is this Cardio Miracle, which I've been using. It is amazing.
Yeah.
Then
Oh, yeah.
Terra Essential Oils, and then EC3 mold solution. Uh, so just wanted to make sure that I can present um, how to find you and what is on your page. Uh, so other than these essential oils, other than melatonin, sauna, exercise, what else can help with sleep?
So there are many other options. Another one is a device that I started using and using for my patients, which is basically an electric mattress pad that stimulates 4 points of the spine from the neck down to the lower back. And what the electrical stimulation, you basically put it on your mattress underneath the mattress cover, you plug it in, and what it does is it stimulates these four spinal points to do two things. Number one, increase the amount of melatonin that your body is creating naturally. And number two, it's stimulating the vagus nerve. And the vagus nerve is this wide ranging cranial nerve that travels from the brain to different organs in your body, what's called parasympathetic. It shuts down during for rest and relaxation. And the exciting thing is from the studies that I've seen, again, this is a brand new device, it increases the amount of N3 sleep by 50%. And I can vouch for it personally. Now, I did not have a formal sleep study, but there are patients who have. But for me, I did not used to sleep. I'm sorry, I did not used to dream. But now, after using this sleep map, I am getting vivid dreams. It's talking to aliens, and it's crazy, but it's worked, and it's not something like, well, maybe after a couple months. No, like you notice this after the first night or two. So, and if anyone is interested in getting it, you can go to atca.ai / sleep. So that's atca.ai/sleep.
Okay, I'm going
And
there right now.
yeah,
So this is atca.ai/sleep, and it says
correct.
products. Once again, no, I don't have any commissions or any strings attached here. So this is Alzheimer's Treatment Center of America and SWDS 2003 deep sleep device, $1,450. And then here is its description. So very interesting. Thank you very much. And I have
Sure.
it here as well.
Right. And just to be clear, if you can increase the amount of N3 sleep by 40% or 50%, sure, you may not get up to the 2 hours you had when you were 18 years old, but we're seeing dramatic improvement just by increasing that deep sleep.
Interesting. So I have a few questions as well that I'm going to ask you. But before that, I want to tell you my experience as well. Fish oil, strangely, fish oil. Every time I take fish oil, I sleep like a baby. I have no idea why it gives me sleep. I'm knocked out.
So that
Okay.
that that that's not unique to you. It turns out that omega-3 fatty acids decrease inflammation. So if we can decrease the amount of inflammation in your brain, it makes perfect sense that the amount of GABA, which is a calming neurotransmitter, will go up.
Interesting. Thank you very much for that. So that means I should care for maybe brain inflammation. So I have a few questions from audience here as well.
Great.
Ari says, what is the effect of taking melatonin on testosterone levels in men?
Yeah, so there can be a decrease in testosterone, but what I would argue is that if you're getting more N3 deep sleep, that in turn could long term cause increased testosterone. So this is a complex pattern, and I'll just be upfront. I am not opposed to testosterone supplementation for men with low testosterone, because it turns out that for normal brain function, you need ideal uh, testosterone and other hormone levels. So, to my mind, if these supplements are tweaking up or down a little bit the testosterone, I can always fix that through supplementation.
Understood. Thank you very much. Here's another question. Melinda says, do the newer antihistamines like Allegra impact N3 sleep?
And the unfortunate answer is, unfortunately, they do. Not as much as Benadryl, but from the studies I've seen, there still is an increased risk with long-term usage of getting Alzheimer's or other dementias. So then the next question is, great, I've been on Allegra for years. You're saying I probably shouldn't be on it long term. What else can I do? And what I would say is people will take Allegra as an antihistamine because they're having allergic reactions. I would say let's try to figure out, let's go to the root cause. I'm a big fan of what's called functional or integrative medicine, where so instead of taking a medication to dampen down your histamine or your immune system, why don't we find out what you're allergic to? It could be that you're allergic to gluten, in which case you would cut out whole wheat and other gluten products. It could be that you're allergic to dairy, in which case you would cut out the dairy, the cheese, the other products. It could be that you have mold problems in terms of mold spores and mold toxins in your body, in which case we would identify those and detoxify, remove both the toxins and the infection. So yes, it's more work, and yes, it's probably in the short term going to be more expensive than just taking an inexpensive pill every night, but for your long-term health, it's worth it.
Understood. Thank you very much. Sorry, continuing with the question. Sleep is actually a very important topic, and especially when sleep is connected with the Alzheimer's and dementias. Sigrid says, my sleep is impacted by pain and I'm on buprenorphine, but that also affects sleep. Is that a drug of concerns towards Alzheimer's?
Yeah, so definitely. Buprenorphine um, can definitely affect your sleep. And I can tell you from the studies, narcotics like buprenorphine long term will increase your risk of getting Alzheimer's and dementia. But it's easy for me to say, but unfortunately, narcotics are highly addictive. And I can tell you from not personal experience, but experience taking care of patients with chronic addiction to narcotics, it can be extremely difficult to wean them off of it. So, first of all, I'm not suggesting anyone on chronic pain meds like morphine or buprenorphine should get off of them cold turkey. But I would say that I think it's a reasonable long-term goal to try to wean off of narcotics, because again, long-term, it is doing damage to the brain. And the mechanism, it's fascinating. The mechanism is long-term narcotic usage is associated with increased inflammation. So there
Interesting.
are a few experts out there on deprescribing narcotics, and I would find an expert in that field, and don't try to do it overnight. But there are other modalities, whether it's acupuncture. But one thing that's fascinating, I worked in a fasting center for a few years, True North, up in Northern California, close to you, Dr. Bean. And the fascinating thing is when people would do a water fast with us for up to 40 days, often their addictions would go away. So if I happen to be addicted to narcotics, I would look at a place like True North or a similar place to do a water fast to try to wean me off of that addiction.
Understood. And generally, anything that would disturb the sleep would take away the benefit of the sleep. And so naturally, then there is a problem with the cognitive decline as well.
True.
So there is a very interesting comment here. The comment is by His Love. I take magnesium and vitamin D3 at night.
Yes, so I am a fan. First of all, most people or many people are deficient in vitamin D3. So in general, most people out there do need to supplement vitamin D3, and I find it does help. But also, most people tend to be deficient in magnesium. So I'm a fan of taking magnesium, especially if you want to get to sleep. And there are different forms of magnesium you can take. There's liquid magnesium, there are magnesium pills, and another one is you can you could actually in a bath. There are Epsom salt or similar type of baths where the magnesium you sit on it and basically the magnesium gets absorbed through your skin. So I'm a big fan of magnesium. Another amino acid that's helpful for sleep is called taurine or taurate. So magnesium taurate can also be a great supplement to help get you to sleep.
And if I can add one more little piece of information about magnesium, I discussed that on my drbeen.com lecture set in pain management, that magnesium, the pain fibers. So imagine if there is a pain fiber from my skin and it is going all the way towards my spinal cord. The second fiber here in the spinal cord, when it receives signals from the first fiber coming from the skin, it has controlling channels on it that are magnesium controlled. So they temper down the pain and reduce the inflammation. I do not know if we all know this, that pain can actually create inflammation by causing substance P release on the pain nerve endings, which would then cause inflammation in that area. So taking magnesium actually keeps that control on pain signaling as well, which would not only reduce inflammation, but also improve sleep because there are less pain signals coming in from the body.
That's completely right, and I love that suggestion. Another suggestion I like from Christine in the audience: L-theanine. L-theanine is another supplement that will definitely help relax you and get you to sleep. It's helpful. I'll tell you one thing that's not good is alcohol. So alcohol or benzodiazepines like Xanax or Ativan will definitely get you to sleep, but the problem is it won't be the deep restorative N3 sleep.
Interesting. Thank you very much. So there's another question. So today your lecture is audience lecture. They are the one who are asking your
I love it.
questions.
Yeah, we're here for you. So
Absolutely. And for Cool Beans, today at 1:30 earlier, I was on Dr. Josh's podcast, and we were talking about inflammation of the brain with the spike protein, COVID or vaccine, and then is that possible that there would be inflammation and acceleration of Alzheimer's? So I think that would be a very nice podcast to listen to as well. So here is a question. Melinda says, does low dose naltrexone impact sleep?
and the answer is yes, it does, and it's something worth taking. So just to explain, naltrexone is a drug that normally could be considered a narcotic type reversing agent. Um, that if I found in the emergency room someone who stopped breathing because they had a large dose of narcotics, you would give them naltrexone to try to reverse that. So this is a little bit different. So instead of in the emergency room, I might use 300 milligrams of naltrexone. This is different. This is low dose, which may be like 1 milligram, and it's almost like homeopathy. If you give a very low dose, like 1 milligram, you're resetting your immune system because there's a connection between narcotics and your immune system. So if you take a low dose, like 1 milligram, that can reset not just your immune system, it can also help with sleep. And I've seen it help dramatically with patients with chronic pain. Now, I'm not saying that if you have severe pain, it's going to take you from a 10 out of 10 pain to 0 out of 10 pain. It might, but it might only take you to a 5 out of 10. But it's a step in the right direction. And just to be clear, at least in the United States, it's a prescription drug. So you can't, unfortunately, get this over the counter, but there are websites out there that will definitely help you obtain this drug if it's right for you. But if you're already on high dose narcotics, taking low dose naltrexone is a no-no. So there are details.
Understood. And just a disclaimer that these are not medical advices. Please talk with your doctor as well. However, this is very educational. And Dr. Josh, thank you so much for all of this knowledge that we just extract from you after calling you here. So thank you.
I
Uh,
love it.
there is a thank you. So there's a question not really directly related to sleep, but still an interesting question to answer. Stephanie says, "Is Alzheimer's a prion disease
Yeah,
or
and I
prion?"
think I think the answer is actually it is, but let's take a step back and explain what prions are. And this is kind of this it was a mystery when I studied biochemistry in the late 1980s, um, or I was just saying the 1980s at Harvard undergraduate. It was I remember they presented all these theories. Basically, prions are diseases like what's called kuru, or basically for cannibals who eat brains or flesh from other humans. There were these diseases that could be transmitted, and they were able to identify um, the, the 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 dangerous part was in the brain, that there's some infectious process, a prion, which stands for a protein um, form of a pathogen. Now, even though this is many decades later, we still don't have the we don't know everything about prions. But let me tell you what we do know about Alzheimer's, where I think there is a connection with prions. Specifically, if you look at the brains of people with Alzheimer's, they have high levels of amyloid protein and tau tangles. And both of these processes, I believe, are related to poor folding of protein. So I think, unfortunately, that we can consider one one angle to Alzheimer's is it is a prion disease. But let me just be clear, because we have 30 to 200 root causes, this is one piece of the puzzle. It's not the only piece. I don't think we're going to find an anti-prion drug that is going to fix the process. To give you an example, there are a couple prescription drugs right now that are FDA approved for reversing Alzheimer's. And uh, the problem is, in a third of the patients, it goes after and decreases the amount of amyloid, but a third of the patients get brain bleeds and brain swelling, because amyloid also is the way that the brain heals injury and fights infection. So for that reason, I'm a principal investigator of a FDA approved drug for compassionate use, so a much younger drug in the pipeline that decreases inflammation, specifically galectin 3. We have lectins, galectin in our body that gets too high with chronic diseases, including Alzheimer's, and I'm seeing great results without the side effects just by decreasing the amount of inflammation in the brain for patients with Alzheimer's. But to go back to the original question, I think yes, Alzheimer's, one piece of the Alzheimer's is abnormal protein folding, which then causes other folding problems. So from that perspective, yes, I think one piece of Alzheimer's is as a prion disease.
Understood. Thank you very much. And talking about the misfolded proteins, uh, wouldn't the intermittent fasting or fasting help as well?
I think it would, because the exciting thing is when you fast, it's and just to take a step back, unlike our modern society, our ancestors hundreds or thousands of years ago had periods of famine where, food was not available 24/7. There was not reliably 3 meals a day. So for that reason, we as humans are designed occasionally to have periods when we have to fast because food is not available. And as part of our biochemical design, when we fast, that is the time that the body recycles and gets rid of damage proteins, including, I think, some of these amyloid proteins. And we call that autophagy, where the body eats itself. In this case, it's recycling, or it's getting rid of the damaged protein so that stem cells can come out when the fast is over and then start regenerating normal tissue. And in this case, we're talking about brain tissue.
Understood. Thank you very much. Uh, a few more questions. You can you can go hands up whenever you like and say I'm done.
No, these are great questions. You've got a very inquisitive and educated audience, so I love this.
I am very proud of the work that we have done together and learned and understood the mechanisms and come to love the mechanisms. So here's a question. Gigi says, what about this C15 for protecting from Alzheimer's?
Yeah, so my opinion on C15, to be upfront, a couple years ago, I was actually taking C15 myself and recommending it for my patients, just so people understand it. C15 is an odd chain fatty acid. And it turns out biochemically that odd chain fatty acids are metabolized differently than the even chain. And I remember, 35 years ago, learning the different pathways. But it's fascinating how human fatty acid metabolism developed over time. But fast forward to so even though I took C15 myself and recommended it, I went back and I looked at the studies for C15 in humans, and I did not find any that I thought compelling as a way to protect from Alzheimer's or to promote brown fat or weight loss. The studies that I saw were done in dolphins. I think dolphins are cute, but unfortunately, what I've come to learn is there are different animals have different biochemical pathways. So just because C15 helps dolphins doesn't necessarily mean that it would be helpful for humans. So what I'm saying is, until there's more credible research in humans, I'm saying I'm not taking C15 myself, and I'm not recommending it. I'm open, and if there may be a new study that's come out in the last month that I'm not aware of, but right now I'm not promoting C15.
Understood. Makes sense. Another question, John says, does LDN impact N3 sleep? We kind of talked about it as well.
Sure, but just quickly, low dose naltrexone, I believe, will help promote N3 sleep. It's not the first thing I would try. The first things I would try were, a sauna before you go to sleep, and take some lavender, take some L-theanine and magnesium. Now, if those things don't work, sure, then consider low dose naltrexone. That's a prescription drug. You've got to see a physician. So I'm not opposed to people trying it. It's just it's not the first thing on my list.
Understood. Thank you very much. And there are tons of more questions. I'll go. One more is very interesting. And after COVID and vaccines, tinnitus has been a problem for many. And cool beans, I have my cat Kyrie running around in front of the camera, so my apologies for that. So the question Deb says is, my tinnitus is louder, now sleep is harder. So what do we do for patients who have such issues and can't sleep well?
Yeah, so let's take a step back. So in this case, tinnitus is ringing in the ears. And it turns out that tinnitus is a risk factor for developing Alzheimer's, but different things can cause ringing in the ears. And often it's associated with increased inflammation in the brain. So it makes sense. If your brain inflammation is increased, not only is your ringing in your ears louder, but also it could be that if your brain's inflamed, it's going to be a lot harder for the brain to relax. And what, to me, this would be a trigger to say, wait a second, why is my tinnitus increased? It could be that you've got increased inflammation from heavy metals in the brain, or plastics, or infections. I mean, as you mentioned, you just did an amazing interview about spike protein. It could be that we're dealing with inflammatory agents for like viruses and spike proteins, etc. So to my mind, this would trigger a visit to a good functional integrative doctor who's willing to play detective, and look for the root causes. For all I know, you might have increased mold or mold exposure causing the inflammation. There are literally hundreds of different things that can cause increased tinnitus, including, maybe you're going to loud rock concerts. I mean, there's so many different things that can do it. And so I'm definitely sympathetic. I mean, ringing in the ears, it makes sense. If when you go to sleep, if you've got ringing, it may be very difficult to go to sleep.
Understood. Thank you. Janet says, what percentage of deep sleep is optimal?
Okay, so what I would say is optimal is going to be what you were doing when you were 18 or 20 years old, where 2 out of 8 hours was N3 deep sleep. But just to be clear, if you're 60 years old, it may not be realistic to get you back to 25% N3 deep sleep. So to me, it's not percentage, it's how much time you spend in the N3 deep sleep, because you may spend 100% of the time in the N1 sleep and never get to the N3, and that's certainly not ideal. So I would focus not on percentage, but we want to get you some time down there.
Understood. So there are, again, I skipped some questions as well. My apologies to Cool Beans. Julia says, any truth to using blue light blocking glasses to improve sleep?
Yeah, so I think there is some truth to it, and I'm not wearing blue blockers right this second, but I think it does make sense. Especially if you're. So let's just be clear. It's not just the blue light, right? I mean, your eyes and your brain will react to any type of light. I think blue light is worse, but most of us are dealing with digital devices that are specifically designed to be addictive, and will encourage you to be checking your social media feeds, and keep you from going to sleep that way. And if for some reason you wake up in the middle of the night, instead of going back to sleep, you have, many of us have an addiction, like, hey, I want to check my social media feeds again. So to me, it's not just the light. We've got devices in our life that are designed to keep us from sleeping. So one way is just electronic device hygiene, where just keep it in another room. So that's one way to stay away from this blue light.
Understood. Thank you. There was a question about, what was that? Memantine. So here, I think this is about the memantine. Stephanie
Sure.
says, what is your opinion on memantine?
Yes. So memantine or Namenda is a type of prescription medication that is often prescribed for Alzheimer's. And it does work in terms of helping with some of the symptoms. It's the class of a drug called NMDA inhibitors, and it decreases the amount of glutamate, which is it's an excitatory neurotransmitter in the brain. So it can be helpful for early Alzheimer's. It may help with the symptoms and the decline, but unfortunately, I haven't seen Alzheimer's reversal with memantine. I've seen more, it takes away some of the symptoms, but I'm not opposed to patients trying it, but to me, it's just one tool in the armament.
Understood. Thank you very much. There's another interesting question. S. Orub says, if I am pronouncing your name correctly, apologies if not. With sleeping pills, you sleep and dream. Is that bad?
Yeah, so that's a great point. So if you are taking sleeping pills and you're able to dream, you probably are hitting some N3 deep sleep. The question is, if you don't take sleeping pills, can you still get there and even more? That's my concern. So and often the only way you're going to know that is to get a formal sleep study. So if you're dreaming, that's normally a good sign, but we're not just looking for good, we're looking for ideal or optimal.
Understood. Understood. One more question. Christine
Okay.
says, is the legal marijuana bad for sleep?
Yeah, so I've definitely seen people take marijuana or marijuana derived products to get them to sleep, for example, CBD. So I'm not opposed to using a product like that. But number one, it wouldn't be first on my list. And number two, in terms of the form of marijuana, I'm not in favor of smoking because that will do damage to the lungs. So there are other forms, ways to take it. But I am concerned that the studies I'm seeing, long term marijuana usage is associated with brain damage. And I know it's not a popular opinion, but it's based on some recent articles I've read. So for that reason, it's not the first or second or third thing I would do. I mean, I'm all in favor of marijuana and other drugs being decriminalized, but just because it's decriminalized doesn't mean or legal in certain states doesn't mean that should be the first thing you run out and take. And I have other concerns that there are these CBD uh, produced in questionable ways. You know, and you hear stories about people producing it in bathtubs. Like, who knows what toxins you're getting with the CBD? If you are going to do marijuana, I would recommend what's called full spectrum, meaning from the full plant. But again, like low dose naltrexone and some of these other treatments, it's not the first, second, or third thing I would try. But if it's the only way you can get to sleep, I'm not opposed to you doing it. But guess what? Marijuana is also addictive because it increases the amount of dopamine neurotransmitter in the brain. There are other ways to increase dopamine, including exercise.
Understood. Thank you. So, a couple of more questions.
Mhm.
One is a question here. Primal colon says, have we discussed deep sleep inducing peptides?
We haven't, but there are specific peptides that will promote deep sleep. Uh, I'll be upfront. They're not coming to my mind right this second. I know there's BPC 157, which will stimulate the immune system, may be helpful, but there are so many different peptides. I'm not opposed to it. I would just want to um, see some studies that they're helpful. And the other challenging thing, at least in the United States, is that right now peptides are allowed in oral form, but normally you can't inject them. But again, I'm not opposed to peptides in oral form for sleep.
Understood. Thank you very much. And I am seeing a lot of folks saying thank you for your insights. So, of course, thank you very much for that as well. There are some more drugs that are shown here or written here, and I think we can keep talking about it, but we are also at 1 hour mark too. So how about we wrap up today for Alzheimer's and sleep and how to improve our sleep, and maybe we continue our series on Alzheimer's. But before we go, I
Okay.
want to once again show your presence. So this is Dr. Josh Helman, drjosh.com. This is his site. Then here, Green Brains MD, one word. is
On
his
YouTube. Yes. Yeah.
yeah, right. So Dr. Josh Helman. So that is one word. This is his website, and so please feel free to connect with Dr. Josh, look at his site, and and have better sleep. And I think that from our last discussion, you know that Dr. Josh actually is an expert on Alzheimer's reversal as well. So that is another area where his expertise can be sought. So, Josh, thank you so much for joining and your insights. I always like a guest where if you can do this, question after question after question, and they hold and they talk about it and they enlighten us. So, thank you very much.
Thanks, Dr. Beam, and thanks to the cool beans out there for creating this amazing community. And the quality of the questions tonight were really good. And thanks again to you, Dr. Bean, for being willing to create this community and field these questions. And yeah, I'd be happy to do this again. I know I know that. I enjoy sharing my decades of experience, and yeah, so peace and plants, and we'll see you soon.
Thank you very much. And bye, cool beans. And thank you once again, Dr. Josh.
Bye bye.